Hello everybody, Dr. Alex Earle here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earle. And of course, this is the time I get to spend with you guys talking about plastic surgery topics and answering all your yearning, burning questions. Okay, and just as a reminder, I am a Ivy League educated, Duke trained, double board certified plastic surgeon. All right, so you know that you're getting good information here. And today I'm going to talk about a subject here which is, I always say, is just as important as the surgery itself. And that's everything that surrounds the surgery, okay? And so we're just going to kind of do like a big umbrella term. I'm just going to call it surgical care, right? So I'm not talking about what my job. My job is to go in there and do the best damn surgery I can and keep you safe and give you awesome results, okay? But there's a whole bunch of stuff that goes into surgery, all right, that is just as important as the surgery itself, okay? And sometimes this can actually be the most daunting part of your journey, because once you've chosen a surgeon, right, that's it, you're done. You're like, Dr. Earle, I want his, signature upside down heart shape. I want the Earle curve. Okay, that's it. I'm going to Dr. Earle. But then you're like, oh, and now what? Where do I stay? Who's gonna take care of me? What do I do? What happens after surgery? And then, the anxiety starts to kick in, right? So that's why we've kind of developed a system, if you will, where we can actually start helping you with all these very, very important decisions. Because I'll tell you right now, I can do the most beautiful surgery, okay? But if the post-op care is not there, the results are gonna suffer. And the patient's gonna suffer, okay? They can suffer because perhaps they're not eating right? They don't have the adequate nutrition. Or they can suffer because they're not getting the appropriate massages or the appropriate faja and compression, okay? Or it can suffer just because they don't have the appropriate people taking care of them and they don't know if there's a problem. Usually if there's some sort of problem and you identify it right away, it can be taken care of quite easily. But if there's a problem and it's not being identified, well, that can make a small problem a big problem. And then perhaps you end up in the hospital or worse, right? So all these things are incredibly important. These are things that you definitely have to think about as you're preparing for your surgical journey. Whether you're coming from out of town or whether you're right here in Miami, you still got to think about this stuff, even if you live 1 block from us, okay? All of this is very important, all right? So what have we done? Well, in order to try to make things easier for you, okay, and rather than you just all searching the internet again, going through social media, trying to figure out who's the best, who's gonna take care of you, etc., well, we've kind of done the homework for you, okay? And so we have a few things that are included in your packages here that are gonna make your life not only a whole lot easier, but a lot safer as well. And it's going to give you the best chance to have beautiful long-term results, okay? So what do we have? And actually, this is part of when I talk about value versus price. I mean, this is how we bring the value to the equation, right? Not only are you getting an experienced, Ivy League, educated, Duke trained, double board certified plastic surgeon doing a procedure who has a record for safety, but we also have all these things included in your package, as opposed to you just go to some high volume, budget center, and all they do is they just give you a price, and there's nothing that comes with that, okay? So, all right, we're gonna talk first about what's called POP Recovery Systems, okay? So we've partnered with POP Recovery Systems, and this is a team that's gonna be taking care of you before, during, and after surgery. Not so much the during part, honestly, but certainly before and after surgery, okay? So you're thinking, well, doc, what do I really need to do before surgery? Well, there's a lot of things actually that you need to take care of before surgery. One of them is, of course, to make sure that you're getting ready to get all your pre-op stuff done, all right? So starting at about 45 to 60 days before surgery, you will get a call from our team here at Pure, and they're gonna give you a list of all the labs and exams and clearances that you're gonna need, okay? But you can start getting ready before that, and Pop Recovery System is going to help you with that. They're going to give you, ideas about, what labs you're most likely going to need. They're going to help you with finding a place to get the labs, the EKG. Say you don't have a primary care doctor, they can help you with ideas in terms of your clearances as well, how to get your medical clearance. So they're going to give you some recommendations for that. Okay, so they're going to start to help you get ready for your pre-op. Okay, the next thing is they're going to help to optimize your nutrition, right? So if you come into surgery, okay, and you're not been optimized nutrition-wise, well, a few things can happen. Say, for example, you need to lose weight because your BMI is too high, and by the time you get to surgery, your BMI needs to be 30 or below. Well, they can help you in terms of your nutrition to make sure that you make that BMI and your surgery doesn't get canceled or postponed, okay? Or what if you don't have the right amount of, vitamins in your body, right? Or minerals. And that's going to then affect your wound healing. All right, so we want to make sure that the nutrition is optimized. Also, kind of within that category, we want to make sure that you stop certain things that can be detrimental during your surgery. Not only just in terms of food, but other things as well, such as your nicotine, right? Which you have to stop all nicotine 30 days before surgery. You got to stop all estrogens 30 days before surgery. If you're on those newer weight loss injections like semaglutide, which is like the Ozempic and the Mounjaro, you got to stop those 30 days before surgery. Okay, so they're going to help you in terms of preparing for nutrition and letting you know what things you need to stop before surgery to make sure you have a successful outcome. All right. Next up, a list of supplies. Now we can provide a list here at Pure, but they have really like the ultimate list here as well. Okay, so a lot of times you're like, oh boy, I'm having a BBL. I have no idea what I need. What do I need? I don't know what I need. And so they're going to be able to provide a list of supplies and, not like the names, the quantities, where to get it. Just make things really, really easy and packaged up for you. Okay? Well, you're going to need a caregiver. All right? Now, there's one thing that I didn't write on here, which it is very important. If you're coming here to Pure, okay, yes, we're going to hook you up with Pop Recovery. I'm going to talk about Men Miami here in a minute. But you are still going to need a person. You're going to need a caregiver. Okay? You need a caregiver that's going to be with you, especially for the first 48 hours after surgery, okay? But ideally while the entire time that you're here, okay? So you do need a caregiver. I want to make that very, very clear. Even though we have Pop Recovery for you, even though we have Men Miami for you, okay? That does not mean that you can't just show up without a caregiver. Very important. You got to bring someone or have someone with you that's going to help take care of you, okay? All right. But you may not know about, nursing care after surgery. So even though you have the caregiver, you may also want to have a nurse taking care of you because they're specialized. They know exactly what to look for. They know exactly how to take care of you, right? And I do highly recommend that. I think that is the best combo. The best combo is to have a caregiver plus a nurse, okay? And therefore you can then stay at an Airbnb or your home or at the hotel that we have here, okay? Now, if for whatever reason you just absolutely can't find a caregiver, well, then the next choice becomes a recovery home, okay? And Pop Recovery can give you the recommendations as to which are the actual good and legit recovery homes. Because, believe me, there's a lot of fraud out there, okay? This is Miami, okay? So, you have to be careful in terms of your recovery home. I mean, there's stuff out there on social media, they'll say they're the best recovery home, they'll take your money, they'll disappear. You'll never see them again. Okay? Or you just go to a recovery home, which is just like terrible. It's like dirty, cockroaches, nastiness. Okay? So you have to be very careful with this so they can provide you with recommendations for recovery homes. Okay? Then they also provide emotional support and mental health counseling. Extremely important before and after surgery. Okay? They have that. And of course, education. So one of the primary reasons why people in general get anxious is because they don't know what's going to happen. They don't know what to expect. Right? So one of the things that we work really, really hard here at Pure as well, which is educating the patients. Okay? So education and communication are extremely important. That's what helps bring down those stress levels, bring down that anxiety, okay, because now you're informed and you know what's going to happen. So education is incredibly important, okay? So this is what Pop Recovery Systems is going to do for you. And everyone who books a surgery with me here at Pure Plastic Surgery will be hooked up with Pop Recovery Systems to help them through that journey, okay? Now, next, so I said they're really focused on the before and the after surgery, okay? Nutrition, super important after surgery. Mental health and emotional support, super important after surgery. Oh, they can also help with, choosing people for massages in your hometown, right? So I'm not talking about Miami. We know the people down here, but the people near your hometown, they could help with that as well, okay? All right, but what about during surgery, right? Well, of course, while you're here, we're at Pure and performing surgery, I'm gonna be taking care of you. But what about right after, right? So that's when we hooked up with Med Miami. Med Miami is a premier group of people that will take care of you after surgery. So that means that depending, you can buy whatever package you want, but they can provide transport. So they can provide transport from the recovery room to wherever you're at, your home, Airbnb, hotel, okay? And then they're going to provide post-op care. And how much post-op care you want is also that you'll be able to discuss with them. You know, I typically like the 2 days worth of post-op care, but you can do 12 hours, you can do 1 day, you can do 2 days. So there are going to be some options there, but I think the first 48 hours are the most critical, and that's what I would definitely recommend. Okay, to have some post-op care during those first 48 hours. Okay, so they'll provide the post-op care, the transport. If you need IV therapy, they can arrange that for you. And they can also arrange massages as well. Incredibly important, okay? Now, IV therapy includes just, hydration, also vitamins, and also iron supplementation, okay? So they really provide all that. These are experts. They know exactly what to look for. They know what's normal. They know what's worrisome. They have a direct access, direct line to us at Pure. So if they see anything that they're worried about, they call us directly. They call whoever's on call, and we take care of it. Like I said, if you identify a problem early, it usually remains a small problem with the solution. If you're too late, it can become a big problem, okay? And that may need a higher level of care, which is never good, okay? All right, and then of course, people are asking where to stay. So we do have a partnership with a hotel very, very nearby, the AC Hotel here at Dayland. It's probably, less than 10 minutes away from Pure. Okay, so very, very close by. And so that is available to you as well. Okay, so we basically solved, if you want to call it this way, we solved all your problems, right? So now, we have the recovery system to help you before and after surgery, and by after I mean like in the long term, okay? So in the longer term after surgery, we have the people that can take care of you, immediately after surgery while you're here in Miami, okay? And then we have the place to stay. And of course, we also have our masseuse, Jessica. She's awesome. So she can do your massages here at Pure, or she can go to where you're at. Especially if you're at the hotel, she goes there too to do massages at the hotel. Okay, so we have pretty much everything that you need taken care of for you that eliminates the anxiety, it eliminates the stress, and it makes sure that you're educated, that we have good communication, that you're going to be safe. And that's the value that we bring to everything here at Pure. Okay? All right. Questions?
Okay. Gaining and losing weight after a BBL. How long to wait for round number 2?
Wait. Is that one question? Okay.
Yes, well, that's one question.
Gaining and losing weight after a BBL. Let me just address that. Typically, after a BBL, if you came in with an ideal weight, then you shouldn't try to gain or lose a lot of weight after the BBL, right? Your weight should be fairly stable. Now, this is what I recommend to all our patients. In the first 3 months after surgery, after your BBL, you certainly do not want to lose any weight, okay? The weight that you came in for pre-op, the day before surgery, that becomes your new baseline weight, and you have to at the very least maintain that weight for the first 3 months. Anywhere between the baseline weight to maybe plus 5 pounds, you want to stay in that range. Having said that, you don't want to gain too much weight, right? You don't want to be gaining 20 pounds. That's not good either. Okay, so you want to be between your baseline and plus 5 pounds. That is the ideal range where you want to stay. Now, in terms of getting a round 2 BBL, well, if your round 1 was a BBL and you want a round 2, then you got to wait at least 9 months. Ideally a year, but a minimum of 9 months. Okay, that's if you're having the 2 rounds of the same thing, right? You're having BBL and then round 2 BBL. Now, if you're having, say, mommy makeover and then a BBL, well, those are 2 different surgeries, and that can be done at 3 months, right? So mommy makeover, 3 months later, BBL.
How do we calm our anxiety before our surgery?
Great. You first of all, you book with us, and then we can get you hooked up with Pop Recovery. All right, all right. I'm kind of joking a little bit, but that is true because why are you anxious, right? A lot of times it's because there's you don't know what's going to happen, so there's haven't been educated. Maybe there's lack of communication with whoever you're trying to communicate with, or there's just you're just anxious about this big event happening in your life for which you could use some emotional support and mental health experts, right? So a way to do that is, well, first of all, go to a surgeon and a facility that you're comfortable with and that has safety as your number 1 priority, right? So that's the first step. The second step is get educated on what you're about to do, the entire journey of the process that you're about to do. Go to places that provide education, such as our YouTube channel. You can listen to these lives. You can go to our Facebook group. Okay, all of these places are going to provide education. Okay, you want to go to a facility and a surgeon that communicates easily, and you want to get emotional support, which you can do, of course, through Pop Recovery Systems. Once you book with us, you can also go once again to our Facebook group and talk to some of the people on there, some of the vets that have gone through this already. And they're going to help you with any questions that you have and to provide also emotional support, okay? One of the differences with POP is that they do have true mental health experts and counselors there that can help you as well, okay?
Okay, let's go to the other one. How many massage do you recommend after a BBL?
So that's a good question, and I recommend an absolute minimum of 20 massages after BBL. Okay, now that is the baseline minimum. There are some patients that are going to require more. Okay, so you gotta plan for that. Again, you gotta plan for that ahead of time. One of the things that Pop Recovery also helps plan is in terms of like your finances, right? They give you if you need financing, they have recommendations for that. Whether you're gonna need Care Credit, Alfeon, Cherry, okay, and they also help you kind of budget, right? Financing and budget in terms of what you need to budget for after surgery or during surgery in terms of the stuff that it's not the surgery itself. For example, supplies and garments and massages, all right? All of this is important information to know as soon as you can, as up front.
2 questions.
Yes.
BBL is fat transfer, and why they talk about round 2 of BBL?
So BBL stands for Brazilian butt lift, okay? And it's what's become the most common term for a procedure, which technically is actually liposculpture 360, meaning the entire trunk. So liposculpture 360 with fat transfer to the buttock and hips. Of course, that's a little bit of a mouthful, right? Every time you're saying, okay, liposculpture 360 with fat transfer to the buttock and hips, so everyone just refers to it as the BBL or the Brazilian butt lift, okay? But yeah, it certainly involves fat transfer and typically the buttock and hip area. Why would people want to do a round 2? So there can be several reasons for that, okay? One, say if you're on the higher BMI side, there are limits as to how much fat can be removed in one stage, right? So for example, here in Florida, the max that we can remove is 4 liters of fat at one stage. So if you're in the higher BMI side, you may have more than 4 liters of fat you want to remove, in which case you can come back for a second round to remove more fat. How about if, for example, you're on the other side of the BMI scale, you're the lower BMI scale, your BMI, say, for example, is now 20. okay, and you have a certain look that you're going for. You want to have a certain amount of hips, a certain amount of projection. Okay, well in that case, you may need 2 rounds because there's just so much fat that we can remove in the first round, and of course we use it all. But if you want more hips or more projection and more booty, then you're going to come back to, at a second round to add to what was done in that first round. Okay, another possibility is plain and simple booty greed. And believe me, we see that a lot. I don't know how many patients are coming like, Dr. Earle, I'm one and done. I'm just going to have the 1 round and I want, and that's it. I'm not going to come back. I'm not going to do this again. And then, they'll come back 6 months later. They look beautiful. They have an enhanced natural shape. Everything looks great, just like like it's always been there, like it was always been there. And they're like, I want more. I want more booty. So yes, booty greed is a thing. And that's why a lot of patients come for round 2. Okay? And last but not least, maybe you just want to tweak certain things here and there. That's another possibility as well.
What's the highest BMI you'll take for a BBL?
So the highest BMI that I take is 30. Okay? There have been multiple studies, not just in the plastic surgery literature, but just in general, where complications start to go up after as the BMI goes up. And if you're looking at that graph, that it really starts to spike up after the BMI goes up through 30 and certainly after 35 for sure. I would not recommend any elective cosmetic or plastic surgery procedure with a BMI of 35 or higher. I would just not recommend that ever. No matter where you go, what country, who's doing it, don't do it. You got to get below that, okay? And if you want to lower complication rates even further, the max BMI is 30, which is why I choose that as the max.
¿Se puede hacer abdominoplastia, senos y lipo de espalda juntos, en español?
Sí, seguro. Bueno, la combinación de los senos y el abdominoplastia o el tummy tuck es muy común. A eso por lo general le decimos el mommy makeover, aunque no tiene que ser mamá para hacer ese procedimiento, es solo lo que le decimos, el nombre que le ponemos. Ahora, no, por lo general la lipo que está incluida en ese procedimiento es la lipo aquí a los costados y a la cintura, ¿ok? Por lo general no es la lipo en la espalda. Ahora, si se pudiera añadir a alguien que no tiene mucha grasa, es posible. La cosa es que aquí en la Florida tenemos ciertas reglas, y una de las reglas es que cuando hacemos un tummy, estamos limitados a solo poder remover 1 litro de grasa con la liposucción. O sea que por lo general es lo que uno tiene de grasa aquí en los costados y en la cintura. Y no nos da para poder también sacar grasa en la espalda. Ahora, si eres una paciente que es un poco más flaca, quizás se puede considerar. Así que mi recomendación es que nos manden la información y así podemos hacer una evaluación y dejarte saber.
Can I get a reverse tummy tuck and lipo 360 BBL together?
Oof. So once again, unfortunately, here in Florida, we're gonna have the same limitations, right? A tummy tuck, a regular tummy tuck, reverse tummy tuck, fleur-de-lis tummy tuck, whatever type of tummy tuck, the rules are the same. If you're having a tummy tuck, you can only remove 1 liter of fat via liposuction. And so typically that's not gonna be enough in terms of a lipo 360 and a BBL to really get you the results that you want for that lipo 360 BBL. So I don't recommend that combination here in Florida.
So it's about the same, but can you do a BBL and breast augmentation at the same time?
Right, same rules apply. So again, not recommended. Also, recovery is just going to be hell, right? Whether you do tummy tuck, breast only, both combined. When you're with a BBL, you're supposed to be laying on your belly, right? To avoid all pressure to the buttock and hips. And of course, when you do the breast or you do the tummy, you have to be on your back. And not only that, if you're doing a tummy, you have to be in a reclined position. So, how are you going to recover? Well, odds are you're going to compromise one thing or the other, right? You definitely can't be on your chest if you have a breast augmentation. That's going to ruin the breast augmentation. So then you have to be on your back. So then you're going to be putting pressure on the buttock and hips, and you're going to be compromising that recovery. You're going to have a lesser result because of that, okay? So my recommendation is to separate out the surgeries, all right? Do the breast and then do the BBL, okay? Or do the tummy tuck and then do the BBL. But if you want the absolute best results from each of those surgeries, it's best to separate them out. And also to lower your complication rates.
If you want a high definition 360 lipo, does your BMI have to be lower than 30?
Yeah, typically yes. If we're talking about high def, that's usually the best candidates are patients that have a lower BMI and that have good quality skin. Those are the two things that are very, very important. Okay, so you have to be lower on the BMI scale. Excuse me. So typically BMI, 24 or less for the most part. Okay, and the skin, especially in the abdomen, has to be like good quality, fairly tight skin. It cannot be loose. You can have a lot of skin laxity there. Can you have some mild skin laxity? Well, that's okay, but moderate to severe skin laxity is not good. If you have moderate to severe skin laxity because of whatever, massive weight loss, multiple pregnancies, one pregnancy, for whatever reason, it's best to deal with the skin issue first. So I would typically recommend to have your tummy tuck first, get that skin nice and tight, and then come back for your HD Lipo 360 plus or minus fat transfer.
How is quality of skin determined?
Right. So when I say that, what is good quality of skin versus poor quality of skin, right? So what I'm talking about is in the technical, it's a technical term called elasticity, which is the ability of the skin to kind of stretch and bounce back. Okay. So when you have youthful skin that has not been affected by massive fluctuations in weight or pregnancy that hasn't been stretched out by a pregnancy, or that hasn't been affected by, say, nicotine or sun damage, then that skin tends to be like this type of skin that really bounces back. Like if you pinch it and pull it out and let it go, it goes like boing, right? It has like a spring to it. That's good quality skin. Typically, it's nice and smooth, fairly tight, and it bounces back. All right. Poor quality skin is skin that's been stretched out, and so it's loose. So if it's overhanging and loose, that's poor quality skin. If it has a bunch of stretch marks, that's a sign of poor quality skin. Or if you go to pull it and it just stays there, it doesn't bounce back, that's also poor quality skin. Okay?
So to clarify,
Yes.
is there are complications more prevalent in lower BMI or higher?
No. Complication rates go up as BMI goes up. Okay? So I'm going to draw it here in a little graph. So, if this is complications, and this is BMI, and this is a BMI 30, and then BMI 35. Complications remain low, and then they start to come up, and then as you get close to 35, they really come up. They shoot up. So it's not even a straight line. It's like fairly flat. As you start getting closer to 30, it starts to come up. As you get to 30, it starts to come up, and as you start to get to 35 or higher, it really shoots up. Okay? That's why for a completely elective surgery, okay, cosmetic plastic surgery, I do not recommend that anyone should have that with a BMI over 35. If your BMI is over 35, your first step is to lose weight. And you can do that now with the injectables. Use semaglutide, do Ozempic, do Mounjaro. Okay, you don't even have to go under bariatric surgery anymore. That's the beauty of these drugs nowadays. I mean, these are game changers. Okay, so do your Ozempic, do your Mounjaro, get that BMI under 35, get it close to 30, and then have your procedure.
Doc, this is a patient out of town. She's at Vegas, and she asks if we have another offices, but I think she can apply.
Yes. So unfortunately, no, Pure, we only just have the one office here in Miami. But as many all know, we take patients from all over the U.S. I think we've had patients from pretty much every single state, including Hawaii, even U.S. territories, Puerto Rico, very, very common as well. So we take certainly a lot of patients from California and Vegas. And we also have a lot of patients coming in internationally, from as far as the UK, so England and Great Britain. And then we've had patients from Australia and Ghana, even Ghana. So people are coming from all over the place here to Pure Plastic Surgery. And we have everything set up for you.
The last one.
All right.
3 minutes. What's recommended for poor quality skin for skin tightening?
Right. So if the skin is like, I would say moderate to severe, okay, in terms of low quality, right? So moderate to severe skin laxity or loose skin or poor quality skin, then I'm gonna recommend a tummy tuck. That's, I'm talking about abdominal skin here, right? If it's in the arm, then an arm lift, but if it's in the thigh lift, back lift, etc. But the point is that if it's moderate to severe, you're gonna need an excisional surgery. Excisional means to cut out. That skin needs to be cut out. Now, if you have mild excess skin, maybe mild, maybe something like lower moderate, but mild to lower moderate, okay? Then we have some things that we recommend that can help with that. For example, the Vaser. The Vaser has been awesome. I highly, highly recommend using the Vaser for your trunk area during your Lipo 360 and your BBL, okay? So the Vaser uses ultrasound energy, and that energy helps in what we call emulsify or release the fat cells, which means that I can remove more fat with less blood loss, less inflammation, and because it imparts that energy, it helps with the skin retract better as well, so you get better skin retraction. So I highly, highly recommend the Vaser, which is actually now mandatory for all of my Lipo 360s and BBL cases, just because it is so good that nobody really should go without it. The other thing that we have for other areas is what's called body tight. So body tight uses a different type of energy. It's called RF or radio frequency energy. And the body tight works really, really well for arms and thighs and chin. So I highly recommend the body tight for those areas. And in some particular cases, we can actually do Vaser and body tight. For example, if you're doing one of our total definer cases, then we can combine all the three modalities that help the skin. We can do the Vaser, the body tight, and the Morpheus. Morpheus is now the microneedling using radio frequency. Okay? So there are a few machines, a few energies that we can use to help with the skin. But if it's severe, like if you're standing and you have the skin flopping over, nothing's going to help that. I mean, no machine is going to really help that. You need to do your tummy tuck. You need to remove all that excess skin. And then you can then move on to your Lipo 360 or BBL or anything else. So I know it's tough coming from the patient's point of view. They're like, oh, you're probably like looking right now, right? You're kind of doing this and like, I don't know. Like, is this mild? Is it moderate? I don't know. Well, of course, that's why you want to leave it to the experts, right? So, so my recommendation is, if you're not sure, that's okay. Go ahead and let us do an evaluation. So send in your information, go to our website, www.pureplasticsurgery.com, click on that virtual consultation button, fill out the questionnaire and send your photos. And then that way I can take a look at everything and determine what I believe will be the best procedure for you, okay? Whether it's, using some of these skin tightening devices that we have, or whether you need an excisional type surgery for your best result and best outcome. Okay? All right, everybody. Well, I hope this was helpful, and I look forward to seeing all of you next week on Hump Day with Dr. Alex Earle. I'll see you then. Ciao.